Alrighty, good evening, everyone. My name is Dayla Burgess. We are very live, and I'm just here with my special guest. Welcome to my YouTube channel. I'm the founder of Teleconnect Bermuda, and these conversations are dedicated to the amazing community people who are in our network doing the amazing work. And I have a special guest here with me today. I have been in this lovely lady's emails, almost hunting her down because I had to have her a part of this community series that I've started. If you guys have been here since the beginning, which was a few years ago, I really started the Therapist Directory Bermuda chats because number one, I feel like therapy, we are becoming more of a therapized world. I think people are leaning more into the healing work. But when it's a small community, who we are and our information is very valuable. And we want to be able to trust these people that we engage with. And you wouldn't believe, just today, one of my family members had asked, side story, hey, Dayla, can I send someone your number? She wants to get in contact with a psychologist or a therapist. And I'm like, well, she's in luck today because I'm talking to a psychologist. Number one, so send her this link. But then I also gave her the therapist directory list that we have over on connectbda.com. So I have been asking this lovely lady to join us, and she's here, and I'm very excited. So please, everyone, say hello to Dr. Kelly Savery of Taproot Psychology. Thank you so much for being here. I'm so grateful. I'm very much a fan, I guess, if you will, a stan of your content and the way that you engage your audience over on Instagram. And one thing that stood out for me, Dr. Kelly, and I'll shut up after this, is how you spoke about trauma and how folks can, especially people in Bermuda, can work through what it is to be traumatized and where people can start. So then I see people like that on socials talking in that way, and with those key words that I hear, I'm like, oh, I have to speak to that person. So here you are. Please share with the viewers a bit more about who you are and how you ended up here.
Cool. Firstly, thank you for like the
Thank
invitation.
you.
It's nice to connect and to be able to share in this way. So I'm Dr. Kelly Savery, as you said, the founder of Taproot Psychology. Uh,
Mhm.
just a bit about me and my journey. So I am a consultant psychologist who then kind of kept training to kind of really develop my skills.
Yeah.
And through my kind of process of, well, first I was a counselor actually, and then I retrained and became a psychologist. And through my placements and my work with people, I started to do placements in kind of trauma centers and like with complex and
Mhm.
kind of people with multiple needs and really severe and enduring mental health problems. And
Yes.
kind of journey, I ended up doing in a specialist training. So the things that I got into first was cognitive analytical therapy. So
Yeah.
that so that's about your relationship patterns and your dances and
Mhm.
really helps us to think about our attachment and how we get stuck and how we
Mhm.
kind of repeat things from the past. And so that was like my first, I think, therapy love where I was like, oh, this makes sense. I can
Yeah.
like when it just makes sense where you can map out your relationship patterns and you get it. And then I was working and supporting people, and in all of the work I was doing, I was like noticing this wounding in the attachment or the hurt, or as they call trauma. And so I started to do my specialist training in trauma therapy, and so I am a EMDR therapist, working towards consultancy. So eye movement desensitization
Mhm.
processing, which I can just speak about if you like.
Yes.
And then I'm really interested, and it like became a part of my therapy and my life in terms of that mind body connection. So I really became more interested in terms of like somatic therapy,
Yes.
connecting to self. And then I trained to be a TRE, so trauma, stress, and release exercise provider. So I'm still
Mhm.
working with that as well,
Mhm.
kind of gradual pieces. So I would describe myself as, how would I describe myself? As a kind of a human meeting a human.
Yeah,
Yeah.
yeah. Well versed too. I mean, like I think it's so important too that you highlighted all of those specialty areas because one thing about trauma research is the research is very clear is that the body is a major plays a major role, our physical vessel in actually healing this stuff. And hence I think the theme of staying rooted in your retreats, right, that you'll get into. So I'm so grateful that you actually went into detail with that. um hmm. Talk to us about your North Star because when I first found your page, I saw that you were connected to the island, but I'm like, okay, is she in Bermuda? Oh, she's doing a UK retreat as well. So talk to us about that. Like, what is your why?
So such a good question.
Yeah.
My connection to home is I am Bermudian, born and bred
Mhm.
and raised. I left the island to study, because
Yeah.
to do what I do, I had to. And so my family is still there. I still feel very much connected to home. And
Yeah.
so I think it's a really big part of my identity. And in terms of growing up in Bermuda and, I even practiced, got the scholarship from the hospital to be able to come and study.
Mhm, mhm.
So that's a big part of my journey as well. And I show gratitude for that.
Absolutely. Absolutely. And one thing that stands out in your social media engagement is with your audience is something that is unique. You have these posts that talk about curse word affirmations, right? And in talking to my audience about having you on, I'm like, listen, I know that curse words don't land well with a lot of folks. Especially the people that I'm connected to, my family, they don't like bad words, but they make me feel safe. And they're actually allowed in my sessions too, with my clients. That lets me know that they're feeling it, right? So how did you actually come up with this this content to use them in affirming yourself?
Well, it's because growing up at home, growing up, within the church and like
Mm-hmm.
our community roots, I was not allowed to tell and say bad words.
Mm-hmm.
I don't even think I really started doing curse words out loud till in my 20s. And then I was like, this word that is forbidden actually feels freeing to be able to
Yes.
say and not let it have this power over me, this control over me, this putting me down, this boxing.
Yes.
The meaning is in what we attribute to it. And so the
Exactly.
affirmations comes from um like a liberation of having to, no, I'm going to change the way I say that, a liberation from traditional healing, right? Because
Mm,
like
love that.
when you think about uh, manifesting and you think about the gurus sitting up and meditating, and it just feels so removed from who I was as a person,
It does. Yeah,
and
I
like
agree.
it's just not accessible. And
Mhm.
actually you add a curse word and you say it in a way that feels good, you
Yes.
then it makes sense. So,
Yes.
you know, so it's like making an affirmation meaningful is what actually works, not just saying it from a book. It has to
Mm,
that aligns with your values, your intention, and your purpose. And so for
yes.
me, adding the forbidden helps me to be like, actually, I really mean it because I mean it so much that I'm gonna curse enough to say it. And so it for me, it takes on something different, and hopefully it brings value to people.
Yeah, no, that I love that too. I love that actual meaning behind it because you're right. When we introduce these concepts and talk about the gurus of meditation and being mindful, the picture just feels kind of removed from who we are culturally in some of our backgrounds. And that's perfect. So yeah, make it meaningful, make it connect,
Yeah.
that's great.
It's
What were you gonna say? I'm sorry.
I was going to say, it's like when people talk about being nurturing or self-compassionate, right? They always talk about it like you have to be like this, like all giving, all nurturing person,
Yeah,
right?
yeah,
My, my self-compassionate self is, I'm not going to curse, but is a bad beep. She has a leather jacket on. She is compassionate, but she is fierce. She is nurturing, but she has boundaries. And so it's like, why does it have to look like a certain way? It can look like
yeah.
us.
Absolutely. Duality, like two things can be true. That's brilliant. So you do talk a lot about trauma, and you have a background in working people through their trauma, right? I've been digging deep into, just like you talked about in some of your training, attachment, why we pick the people we pick. Talked to a relationship and intimacy coach the other day, been digging into, what it means to be traumatized. And I found that the ancient Greek word for wound is trauma. And I'm like, that makes so much sense. Of course it is, right? But when you think about the hurt that we've suffered, if it is a trauma, if we perceive it to be a trauma, it does leave like this unhealed. It's a it's a wound. It's something that hasn't been, patched up or closed or kind of nurtured into, where you can get in and get on and live. It reopens and it affects us in our present day, if that makes sense. I hope it does. So, what I wanted to ask is, what are some of the invisible wounds that you see in your work, working with people who are on this healing journey to work through their trauma?
Yeah, I think that is such like a massive question. And
Mm-hmm.
where you said it just now is very impactful, but also very insightful, right? It's like
Mm-hmm.
because sometimes we have, I think, experiences that we can identify and see, like, for example, women or men who've been sexually assaulted or hurt in that way, or children who have been left or abandoned, or veterans, people who coming back from war, or people who escape conflict. I'm trying to give examples as we go. Surviving
Yes, yes.
hurricanes, surviving
Mm-hmm.
like big life events. It could be given childbirth. It could be medical negligence. It could be chronic illness. Like that's
Yeah.
something like no one being able to understand. Some
Mm-hmm.
even be being neurodiverse. Like I was talking to someone today about their experiences and the hurt of feeling different in a neurotypical world. And so, and I listed some of the examples, but I think the main thing that I like to hold in mind when I'm supporting people and when they come to work with me is like for me, it's about like how you make sense of your experiences and what happens, what makes something traumatic is not
Yeah.
actually of being in an event, but how your body has kind of been overstimulated or kind of overwhelmed or shut down as a result
Yes.
of what's happened. So it's all about our nervous system and how
Mm-hmm.
it's unable to comprehend and cope.
Mm-hmm. Yeah, and that's such a beautiful way to actually answer that question, right? Because it's not an objective thing. We have all of these experiences that, depending on the physiological makeup of a person, right, and their own belief systems, it's going to differ. What I may perceive as like really traumatic might not register or resonate with someone else. I want to just switch gears into that as well, because you did highlight a broad range of experiences. I do believe that collectively in Bermuda, we are unique batch of people. Love us, right? I love this country, love our people. But
Mhm.
there has recently been a lot of conversation, not recently, but you kind of see these conversations popping up and talks of like, the cost of living and what that creates for families and people. bike accidents and car collisions where people succumb to their injuries and pass away. And things like gun violence and the families, generations of families who are left without their loved ones. What are something that, or what are some things that we can do, for the people who do watch this, the Bermudians that do watch this live? What are things that we can do as a collective to begin to kind of acknowledge those wounds in our community and work on them, like individually? I think we all have a responsibility, but what does that look like? And I know that's a big question, but what do you think about that?
Okay, a lot. So,
Yeah.
and I think the thing that we're describing is both the direct experiencing of like these events, but also
Yes.
kind of, I just want to acknowledge that the witnessing of and how that is also indirectly traumatizing. So we have both
Yes.
the experiencing of and the witnessing of, and how we can be in both of those spaces at once. And so it's incredibly hard in such a small community because we feel collectively the pain of our neighbors. And that is part of our culture, that is part of who we are, but it's also genetically, because of proximity, a reality. So, yeah. And so in
Yeah.
terms of what we can do, I think the first thing is what we're doing right now, which is acknowledging, naming, and describing what it is that we're dealing with. And, especially on the island, I think that there has been a tradition historically of like really pushing away from the hard stuff, really
Mm.
not wanting or not feeling able to be able to explore it and to kind of be able to say, this hurt me, because when we're all part of it, who do you go to get that
Yeah.
acknowledgement? So I feel
Yes. Yes.
step one is actually being all of us, which I think collectively we are starting to do, but all of us
Yeah.
being brave enough to own this pain and this heart that we have, because
Hmm.
that we're repeating it is from our heart. A lot of the gain was a lot of the conflicts, it is from our heart,
Yeah.
and not being able to process it and deal with it in terms of, yeah. Okay, sorry, I went on a tangent, but I'm
No,
gonna.
no, no, that's excellent. That's excellent. And I like what you said there about it. We have to own it because we tend to otherize it. We push it over there. That's for that segment of that community. But there are lots of Bermudians here who are all impacted. And I think that's where it begins as well. I love that it's owning it. Like these are all people. They, these are still our people.
And that's the reality. And when it comes down to the cost of living and how hard it is on the island,
Mm,
and we know that and we acknowledge it, and it's like, let's not act like it's not a big deal. Let's like work together to say and be how we used to be in terms of sharing and kind of leaning on each other to be able to kind of
yes.
support each other. Um, so I think that for me, that's step one.
Yep. Yep. It's a beginning. I
Again,
agree.
and
Yeah.
in that, we can also start to lean into each other and kind of hold each other. I think sometimes when it comes to healing trauma, people always think about therapists, they always think about like needing to do something. And I think we do need to, hey, we're human, right? And so it's human meeting human. So holding on to our own humanity in the midst of hurt and trauma and being able and willing to lean in to each other is
That's right.
part of the healing process.
That's
And
right.
so it's the acknowledgement, but it's also coming together as community and as an
Mm,
individual, being willing to share our humanity with other, being willing to see the people in front of us and, stop for 5 minutes to check in is something that we can do tomorrow, today.
that's right.
Check in on your friends, your family, that stranger,
Mm-hmm. 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 Yeah. I think that's a perfect segment to what I wanted to actually highlight in this talk is your rooted trauma retreats that you have hosted in the UK, but you actually have one coming up this year in Bermuda. Is any of that that community need was that a part of why you chose to start these events?
It was the main reason,
Mm,
the main reason, and the main reason why I'm offering them in Bermuda. And
mm,
like, because, it's an opportunity for women at this point at home to access, a type of support that is hard to get on the island. And it's hard to, I've had the privilege to be able to do these trainings, and, it's an honor to be able to then offer it to others. And so in the kind of a retreat space, it offers us a chance to be together in the healing process, to
awesome.
lean in. And I have some like great people on island who are kind of contributing to that process of like trauma-informed yoga and movement
Mm.
therapy. And I do group EMDR, and we have expressive art therapy. And I
Wow.
have a fantastic co-facilitator from the UK, Therese, who flies in with me to be able to offer some of the other kind of therapy approaches. And we talk about your attachment and polyvagal theory, which is about your nervous system. So um, I think it's really hard to get all of that in one space.
Yeah. Yeah.
If you know what I mean? It feels like
Yes.
when you're trying to heal and somewhere you're like going here, you're going here, you're going here.
Yeah.
Where like the opportunity to take a breath and just experience and be held and be supported and not have to think about your safety, because that would be my job, like be able to just be in the moment is a
Mhm.
opportunity.
Yeah, that is, I agree with that in such a big way. Just briefly, trying to find people the appropriate treatment, the appropriate method to work through what they've identified is so hard in Bermuda. And often when we are even referring out to other services, it feels so disjointed. It feels very disconnected from what we've created in the container that we started. So that is beautiful. And I'm going to get into how people can actually get to, if they're interested, sign up. Ladies, it's for women to actually participate in this fantastic event that's happening in November, correct? Okay, beautiful. Um, so, and we kind of touched on this briefly. Uh, I'm wondering if I should leave this question for the last, but tell you what, let's go into this one. You talked about attachment. Because you talked about attachment, I think that it is so important for us to actually acknowledge attachment traumas or developmental traumas that lead to attachment wounding. And all of that means it's about our initial relationships, the relationships that we had with our caretakers, our parents, the people who are responsible for us. But oftentimes it feels like, Dr. Kelly, we only focus on the neglect and abuse, like the physical stuff that happens, when these things are just as big or hurtful, painful. Um, can you talk about the lasting impact? Like, why is that stuff like attachment trauma just as important as the big traumas that we talk about, the abuse and the neglect?
Because I think thing that is so interesting about being human, even though
Mm-hmm.
we learn as we get older and we can adapt because of neuroplasticity, but I think one of the
Yes.
things so kind of for me very curious about us is that it's in those first developmental years, it's when we're a baby, when we're in infancy, that we actually learn how to regulate our emotions. That is, that's the stage where we actually get an understanding of self. And so people sometimes don't really understand how, when we have a unresponsive caregiver, how that can kind of leave us like not feeling able to then reach for support or help. Because
Yeah.
as a child, we have an embodied understanding that when we cried, our parent, our caregiver, or the wider community was not responsive to us. And
Mm.
so I guess that takes us to this understanding of like pre-verbal, embodied
Yeah.
parts of trauma or wounding, something that is pre-verbal beyond language, it can happen in the womb. So the research is showing us that when we have a mother that is kind of stressed or overwhelmed, that has a long-lasting impact on the fetus, and then how
Oh,
they experience stress and anxiety later. And so
mm,
it's all about our genetic makeup. Just to say that that's not like it doesn't determine how we kind of come out and experience the world, but I guess it's about that vulnerability factor to how we might be affected. And so
mm,
but I think it's making me think of somebody I worked with just 4 weeks ago, and they wrote a testimony today, so I'm okay to share it. And we worked on their pre-verbal trauma, so something that they had a felt sense in their body. They didn't have a memory of it at the time, and they didn't have a language for it, but they just felt this abandon. They just felt it. And through we did an EMDR intensive, and so through our kind of work together, what we realized was that this person had a stored memory in the body of
mm.
neglected as a little baby and being hurt as a baby. And then that replayed
Wow.
their entire life. And in the process, and they just had a flicker of a memory, a flicker of an image. It was enough to give us a story. And the story was about their attachment and the lack of care. But by knowing that, they could then put words to it, make sense to it, and then we could kind of create a plan on how to work through it. And so that's why it's important, like the impact on, I think, everything. So our ability to
Mm,
relate our feelings, on our ability to be able to connect to others, not just our partners, because that's the other thing. We tend to focus on our romantic, intimate partners, but
mm,
talk about attachment, it's about our ability to connect with our kids, our ability to connect with our friendships, how we respond to authority figures, how we respond to the community as a collective.
mm,
Um, so the impact for me is just ripples.
mm. Wow,
Okay.
that is so, 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 so powerful. Thank you so much for breaking it down like that as well. It flows perfectly into talking about the felt sense experience and the mind body connection. But I just want to double back to something that you said there. You said that the attachment, the felt sense wounding that this person had experienced was a glimmer, just a flicker of something that had happened in their infancy years. And I want folks to actually to hang on to that, because there are things that this is why taking care of our women when they're pregnant, making sure that these people have safe, nurturing spaces, because the development of that person growing inside them depends on it. And we don't view it like that. And that's why I'm so, so grateful for the work that you're doing in these types of conversations, because when people talk about that felt sense of just like rejection or abandonment and not understanding why, they just want to chop someone's head off just when someone tells them no, can't do it. And there's this, it's just this long distance of just the history of their emotional, wiring and the development. And it gets unpacked in safe spaces like that you create, like with your retreats and of course the work that you do. But if it does, the conversation doesn't happen there, then where does it happen? And so thank you for sharing in that way and being able to so eloquently describe it, because I haven't heard it described like that before. Very, very important stuff. So I too am very fascinated, like I said, by the mind-body connection and how our emotional health is connected to our physical health. And this is something that I've started to unpack on the Teleconnect platform. So when you are helping people integrate, and you touched briefly on this, Dr. Kelly, you said that you were doing some EMDR, you're trained EMDR. When you're helping people to integrate their traumatic experiences, um, how do you witness the physical, I guess in another example, because you just shared, how do you witness the physical ailments actually manifest, the sickness or the hurt in someone's body?
Okay. Okay. So I'll go researching and then I guess I'll
Yeah,
share.
yeah.
The researchy, the scientist brain is like, okay, they have research that has connected traumatic experiences or dysregulated emotion to kind of eczema, to chronic fatigue, to irritable syndrome, to basically any sort of physical ailment that you have. There has been a link in terms of, what happens in the nervous system, how it affects our immunity, how it affects our gut,
Ooh.
how it affects our mind. And so it's like a growing body of research and evidence that really shows us how traumatic experiences or our inability to resolve them can affect our physical health.
Mm.
I guess an example would be I was working with a woman who had chronic headaches, migraines for years. She'd been to loads of doctors. She did all of the physical side of the treatments to kind of get to a point where she understood that it was a psychological process going on.
Yes, yes.
And so she came to sessions with myself, and after we did like exploration and understanding, we did some processing around one, her pain management. So
Mm.
helping her to feel able to regulate the pain first, and
Mm-hmm.
processing around when the migraine started, the functioning of them, and we really got to know it and understood it. And at the end of therapy, this was a person who was having migraines. She was working part-time. She was having migraines that often. And on a scale from 0 to 10 was like the pain was excruciating. And at the end of therapy, her migraines were at kind of regular headaches. So 1.5
Wow.
and
Wow.
reduced to being like specific to specific events or like
Mm.
or so, and that was by resolving her embodied trauma and her by really working through and understanding what was going on for her in those moments, as well as
Yeah.
to help her calm herself. And it took time. Like I think that we were in therapy for about a year, maybe a year and a little bit.
Yeah.
But we saw a steady decrease. And so that's one example of um, working with the root cause, as I call it, like what is the actual problem?
Yeah. Yes. Yes. Yeah.
So,
I that is so profound. So she started a way that you had measured her journey through healing is how she rated her migraines and how they had actually became less intense and less I guess painful because migraines are terrible migraine headaches if you know about them, if you suffer with them. Um powerful stuff. That is great. So how can folks with that information, right? She's walked us through people, different trauma wounding, right? Different trauma experiences, attachment, relationship. It can, like she said, trauma can actually be anything. It just depends on the person's lived experience. How can people actually get in contact with you and work with you, Dr. Kelly? So I want you to answer that question in two parts. Firstly, do you accept clients who are based in Bermuda? Because I know that you do work with Taproot psychology through the UK.
yeah.
Yeah.
So
Okay.
I do work with people in Bermuda on the island as well.
Yeah.
And it is online, so remote working, and that feels really familiar for me. And yeah,
Mhm.
just an adapt the therapy, but it's still proven to be as effective. So the
That's
person that
right.
I just spoke about with migraines, that was all online.
Wow, 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 wow. So you are accepting clients in Bermuda. Beautiful. That is great stuff. So you heard it, folks. And how can the ladies, the women who are interested in your trauma retreat and the community work that you'll be doing in November of this year, how can they actually find out more about that and then actually sign up or register actually for the retreat?
So you can contact me at contact@taprootpsychology.com, and I will
Mhm.
share the link to the webpage and stuff with you. If you could share it with the show notes or
That's
me.
right.
Um,
Awesome.
like if you have any questions, if anyone wants to have a chat or wants to talk about help with finances, just reach out, have a conversation with me.
Mm-hmm. Mm-hmm.
We will see how we can best support.
Perfect. And the last question that I want to put to you, will you please join our therapist directory Bermuda listing on Teleconnect, the Teleconnect website?
Sure. Just I would love to be a part of the community.
Oh, amazing, amazing. Thank you so much, Dr. Kelly. I am so grateful for you actually agreeing to do this with me. I realize that you are a busy healer in the UK. And then also thank you for your work. I want to give you your virtual flowers because these spaces, these conversations, the dedication that you demonstrate is so needed. And our people are in need of more containers that you create and the gift that you have of helping people. So thank you so much, my lady. I'm so grateful.
Received. Thank you.
Thank you. So, folks, I will list everything that you need to know about Dr. Kelly Savery and Taproot Psychology under this conversation. And of course, you can also go to my and her Instagram at Taproot Psychology and Teleconnect Bermuda. I almost forgot my ad on Instagram and find out more about what she has going on as well. So, thank you for tuning in, and we'll see you in the next chat.